Hello everyone, and welcome to this week's edition of the OncoAlert Weekly Roundup. I'm your host, Gil Morgan, reminding you that these are just some of our top picks, but for a complete list, register to the weekly newsletter at www.oncoalert360.com or through the QR code or link in this post. That's www.oncoalert360.com. Now let's dive into the key studies from the past week, starting with lung cancer. A great week of World Lung Cancer Congress in Barcelona with concomitant publications. In EGFR-mutated advanced non-small cell lung cancer, the phase 3 trial of Amivantamab lazertinib versus osimertinib delivered exciting results. Over a median follow-up of nearly 38 months, overall survival was significantly improved with Amivantamab lazertinib, 60% at 3 years, versus 51% with osimertinib, with a hazard ratio of 0.75. Of course, this came with higher rates of grade 3 or higher adverse events, including skin reactions, venous thrombosis, and infusion-related events. But these were consistent with known toxicities. Importantly, the COCOON study demonstrated that simple prophylactic dermatologic regimen, antibiotics, topical care, and moisturizers could significantly reduce these skin toxicities and improve quality of life, showing how thoughtful supportive care can enhance the treatment experience. And shifting to small cell lung cancer, the phase 1b DeLLphi303 study evaluated tarlatamab, a DLL3-directed bispecific T-cell engager, in combination with a PD-L1 inhibitor as first-line maintenance therapy. Among 88 patients with extensive stage disease, median overall survival reached 25.3 months. Toxicities were manageable with no treatment-related deaths, reinforcing tarlatamab's promise and supporting its ongoing evaluation in phase 3 trials. Moving on to pancreatic cancer, a cutting-edge study using cell-free DNA fragmentomics integrated with machine learning showed remarkable accuracy for early detection. The model distinguished early-stage pancreatic ductal adenocarcinoma from healthy controls and non-malignant cysts with over 90% sensitivity across multiple cohorts, highlighting a potential tool for early diagnosis and improved survival. In hepatocellular carcinoma, the review by Morrow and colleagues highlighted how the epidemiology is shifting towards non-viral etiologies like MSALD and alcohol-related liver disease, with improved outcomes from checkpoint inhibitors in advanced disease. Yet, prevention and early detection remain major gaps. And moving on to breast cancer, 2 studies have stood out. The phase 3 BRAVE trial in high-risk early triple-negative patients found that adjuvant avelumab did not improve disease-free survival, although a descriptive analysis suggested a potential overall survival benefit. Meanwhile, an exploratory analysis of the SONIA trial found that pretreatment circulating tumor DNA can predict which patients with advanced ER-positive HER2-negative breast cancer derive the most benefit from first-line CDK4/6 inhibitor therapy, offering a biomarker-guided approach to optimize treatment sequencing. Moving on to renal and GU cancers, a phase 2 trial showed that metastasis-directed therapy alone in oligometastatic clear cell renal cell carcinoma allowed patients to stay off systemic therapy for a median of nearly 3 years, with minimal toxicity. Conversely, in metastatic castration-resistant prostate cancer, the KEYNOTE641 study demonstrated adding pembrolizumab to enzalutamide did not improve survival and increased toxicity, reminding us that immunotherapy combinations need careful patient selection. And finally, in gynecological cancers, 2 long-term studies provide guidance on tailoring treatment. The 10-year follow-up of the PORTEC-3 showed that adjuvant chemoradiotherapy improved survival over radiotherapy alone in high-risk endometrial cancer, particularly for p53 abnormal tumors. Similarly, retrospective data in stage 4 endometrial cancer emphasized the survival benefit of surgery, whether primary or after neoadjuvant chemotherapy, and confirmed the prognostic relevance of molecular subtypes. And ending up with a French study of 272 advanced sarcoma patients that found modest ICI activity overall, but durable benefits in select subtypes. This highlights the need for histology-driven patient selection. So what is the overarching message this week? Across tumor types, precision, whether it's targeted therapy, immunotherapy, molecular classification, or early detection, continues to transform outcomes. But supportive care and judicious treatment choices remain just as critical for improving patients' overall experience and long-term health. That wraps up this week's Roundup. I am Gil Morgan, and you've been listening to the OncoAlert Weekly Roundup. Stay tuned, stay informed, and stay OncoAlert. See you next week.